good evening and a warm welcome to our viewers for another informative live session with BM Birla Heart Research Center, Kolkata. BM Birla Hospital is the only comprehensive cardiac center in Eastern India, and we have state-of-the-art infrastructure for the treatment of our patients. We have been the pioneers in treating hearts since 30 years. Today we have with us our star doctor, Dr. Dhiman Kahali, who is Director Cardiology at BM Birla Hospital. He is also the Chairman, National Intervention Council, CSI, ex-convener for STEMI Council, CSI. So today's topic is a very interesting topic, which is heart and COVID, and is a concern with majority of population in India. So sir, to begin with, I would like to ask a very basic question which our viewers would want to know, that what is COVID-19?
See, it's a RNA-mediated virus infection, mainly affecting the respiratory tract and sometimes causing pneumonia. But it affects many of the organs of the body ultimately, and as you know, it causes many cases death also. And what I want to mean that it's a lethal disease, it's a dreaded disease with high fatality rate, and especially abroad, of course, you can tell that in India the fatality is less, and the recovery rate is also encouraging. Yesterday I was seeing in the evening that they're claiming it's more than 80%. But the problem is that we haven't got any definitive treatment for the disease, neither we have got any preventive aspect of the disease. But anyhow, there are some tips, prevention we'll be discussing within a few minutes, which we can prevent the disease.
So sir, how is COVID-19 different from influenza? Because we see that the symptoms of both these diseases are very similar. So how does one differentiate between the two?
See, COVID-19, as I told you, is a viral infection, and influenza too is a viral infection. But there is some difference in the presentation, some difference in the infectivity, and some difference in the fatality or mortality. Now, in influenza, the initial symptom to start with is cough. But in case of this COVID-19, the first symptom usually is fever. Of course, it may be associated with cough. And third symptom, which is the triad of the symptoms, is shortness of breath, or we call it as dyspnea in medical language. So these three are very important symptoms, and if they are together, we just nowadays think first of COVID and we exclude it because of its high fatality rate and lethal nature of the disease. Of course, there are some other manifestations of the disease like loss of taste, loss of smell, then nausea, vomiting, diarrhea, and I want to tell that the patients who have diarrhea are super spreaders. That means it spreads very fast to other persons. As if a patient is a very young child especially, they are super spreaders, though they have got a low mortality rate, means fatality rate. Similarly, an asymptomatic patient is also a super spreader. He can spread to 358 patients. One person can, spread to 358 patients.
That's a huge number.
So it's a huge number, yeah, it's a huge number. So asymptomatic patients are also to be taken care, and they can spread the disease like anything. So this is the basic difference. But influenza also ultimately after cough they have fever, but the usual sequence is like that. In COVID it starts with fever, in influenza it starts with cough. But in human life it can happen either way. So nothing is absolutely fixed.
So how does COVID-19 affect the heart?
Oh, that's a very important question, because now people have started saying that COVID is rather a vascular disease. Vascular means the arteries, veins, etc., through which blood goes, impure blood comes to the heart, like that. So why it is called that, it has been seen 80% of the patients with COVID infection are asymptomatic, and 20% of the patients are symptomatic, and out of that 50% of the patients are mildly symptomatic and rest needs hospital admission. Means 5 to 10% of the total COVID patients, they need hospital admission when they are serious. Now it affects heart by several ways. The main three ways are: it can cause ischemic symptoms, means it can cause a heart attack. So as a cardiologist, it has become a very important problem to us, a new disease, that many corona positive patients present with a heart attack. And we should know the symptoms of heart attack. Why? Because of the fact that in India we had 2-3 large registries. Recently also we have finished a registry of heart attack patients during the COVID era, and we are going to compare with COVID when COVID was not there, heart attack patients in 2019. So 2019 versus 2020, whether the incidence has come down. So with 44,000 patients have already been recruited all over the India, and we are going to have some data about it. Now why I am telling that we should know the symptoms of heart attack, because from the different registries previously also, what we have done, we have found that the patients come to the hospital much less. Because out of the total fatality, 50% of the patients die before they can reach the hospital. So first 2 hours is very important in a patient with heart attack. So we must know what are the symptoms of heart attack. So usually when heart attack occurs, the patient has severe chest pain across the chest, and a person who has heart attack, he knows how severe is the pain. The distribution of the pain is typically over here in the upper chest centrally, and then it radiates to the left shoulder, and it can go to the upper abdomen. Sometimes, rarely, the pain can start in the upper abdomen, especially when it involves the inferior wall of the heart, and it goes above. So there may be various presentations, and this chest pain sometimes come to the root of the neck or to the lower jaw, and it is distributed like that, and the severity, it is severe normally. And it is associated with severe sweating. Now winter is coming. During winter we put coats, sweaters, etc. or shawls. But a person who has a heart attack, he sweats like anything, and as if few buckets of water has been poured over him. কয়েক বালতি জল যেন তার গায়ে ঢেলে দেওয়া হয়েছে। তাহলে বুকের মাঝখানে ব্যথা, প্রচন্ড ব্যথা, ব্যথাটা বাঁদিকে যেতে পারে শোল্ডারে, ওপর পেটে আসতে পারে, হাত দিয়ে নামতে পারে, এদিক দিয়ে পিঠে যেতে পারে। So this is the typical nature of the chest pain what occurs in heart attack patient, and we should know about it, because we find when heart attack occurs, the patient cannot appreciate that it is heart attack. They think it is because of acidity, it is because of GERD, because মরিতে চাই না এই সুন্দর ভুবনে। আমরা কেউই পৃথিবী ছেড়ে যেতে চাই না এবং থাকতে চাই, এই পৃথিবী এত সুন্দর, কিন্তু আমরা নিজেদের হার্ট অ্যাটাক হয়েছে, হয়তো আমার হলে আমিও ভাববো যে আমার হার্ট অ্যাটাক হয়নি। So that we don't want to recognize that it's a heart attack. Even if we think, we suspect that it may be heart attack, so we must be firm. All of us must know the diagnosis of heart attack, how it happens. And it doesn't subside with a sublingual nitrate. And it is severe, it lasts for hours if untreated, and the patients who die of a heart attack, 50% of the patients die before they can reach the hospital. So that's very, very important. We should know inside out about it. The second, spectrum is the patient has heart attack, but it is smaller in nature. The artery is either not completely 100% occluded, or there are good collaterals coming from here and there and supplying the heart muscle. It is known as end-STEMI in our language. The patient has chest pain. It partially subsides with sublingual nitrates. It is severe in nature. It is sometimes associated with sweating, and I told other symptoms in heart attack and this end-STEMI are shortness of breath, sweating, dyspnea, weakness, tiredness, and a sense of, in heart attack especially, bigger heart attack, a sense of impending death or collapse. And the patient has very cold, clammy extremities, and the pulse is feeble, and sometimes it's very hurried also. So by seeing a patient, we can diagnose that the patient has by history and examining the patient, that the patient has a heart attack. So we must know inside out. And the importance of telling is that in COVID, in 20% of the persons, the symptomatic persons who need treatment comes with symptoms of heart, and number one is ischemia. And it is often seen that this heart attack occurs with non-occlusive disease. Means normally the arteries have major blockages in the arteries, and that causes heart attack in majority 70% of the patients. But here in COVID patients, many a times we see that it is non-occlusive in nature. The arteries are not blocked to that extent, and the arteries have got 20-30% blockage, but there is a rupture and there is a thrombus, and that has occluded the artery completely and has caused a massive heart attack. So it's something different from the non-COVID patient. Second presentation, as you were asking, of heart in COVID is that it presents with irregular heart rate or very high heart rate. We call it as atrial fibrillation. Sometimes it presents with supraventricular tachycardia, and on the other spectrum it sometimes presents with very low heart rate. We call it as bradycardia. And patient has come to our hospital and we have seen that the patient is in complete heart block. The heart rate is as low as 20-25. The patient has fainted, became unconscious, and the patient's sensorium is not good on arrival to the hospital. And we have to put a temporary pacemaker followed by permanent pacemaker. So that is another presentation of COVID patient. And sometimes it presents with atrial fibrillation, means irregular heart rate with very high ventricular rate normally. Sometimes of course it presents with normal heart rate. When it presents with a very high heart rate, the patient may again cause faintness or syncope on the patient, that is transient loss of consciousness which comes again of its own, or the patient falls down because of a DG spell, because of fall of blood pressure. And we should remember that this atrial fibrillation is also a serious disease. And every 12 seconds, somebody somewhere in the world is dying because of this atrial fibrillation. But of course, it's treatable nowadays. There is good treatment for the entity and it can be treated, and we treat it. We treat it as we treat it in non-COVID patients with atrial fibrillation. Sometimes rarely it can present with ventricular tachycardia or other lethal irregular heartbeats. So this is about the irregular heartbeats or arrhythmia. Third entity, that is another dangerous entity, that this presents with myocarditis and heart failure. So the patient complains of shortness of breath, tiredness, lethargy, weakness, and sometimes he has these episodes of profuse sweating or chest pain even, and the patient on examination, his heart is enlarged. Normally our heart is small, बड़ा दिल वाला नहीं चाहता है हम लोग, तो we cardiologist, we want smaller heart. So the heart is contracting like this. But in case of cardiomyopathy or heart failure, what happens? That too with COVID. The heart gets dilated and the heart contracts like this. So what happens? There is congestion of blood in the back chamber, that is lungs, and for that the patient complains of severe dyspnea and he is admitted sometimes in the middle of the night with severe respiratory distress, and if it is so bad, sometimes we have to put the patient to invasive ventilation, means intubation and ventilation. That occurs in COVID patients too. And it's very difficult to differentiate initially, because in COVID patient that can happen because of the severe pneumonitis which occurs. There is bilateral pneumonitis, especially the right lobar pneumonia is there, and these changes also in the lungs sometimes persist, and there is permanent impairment of the lung function. And today in the morning, Rajdeep in India today had a good discussion with a very leading physician of our country who was telling that the ultimate treatment of that fibrosis or impairment of the lung is to go for lung transplantation. So these are the sequelae of the disease. Last but not the least, I want to mention about a dreaded complication of COVID related to heart. Just like lungs, as I told you, that these patients sometimes develop severe pneumonia, bilateral pneumonia, needing even ventilator support, and ECMO, etc., because there is hypotension, there is multi-organ failure, etc., and they need hemodynamic support too, as you see frequently in the newspapers. And these patients, some of these patients, even after recovery, when a person has been designated as the patient is asymptomatic, the patient is free of disease, he has no fever, no cough, their lungs are clear, and the patient is fine, and the RT-PCR has become negative. It normally becomes negative after 3 to 4 weeks. So everything is okay, and it is declared that the patient is fine and okay. At that time, German scientists, cardiologists, they did a very sophisticated investigation known as CMR, cardiac magnetic resonance imaging, in 100 such patients after 6 to 8 weeks. And to our surprise, it was found that 78% of this group of patients had some sort of heart problem. The heart was not contracting well, as I told you, so they had heart failure. They have a dilated heart. Instead of a small heart, they have a dilated heart. And their contractility is very poor, not like this. This is contracting like this and causing dyspnea. Sometimes patients are initially asymptomatic, later on they become symptomatic, and they need treatment. So this is also something new. As Professor Antonio Fauci, who is the CDC director in US and also advisor to President Trump, tells that we know very little about this disease. A person like him, a very renowned pathologist, virologist, he tells, we know very little about this virus. We really also know little about this disease. This is a new entity to us. Patients are declared okay following COVID. After that, people are investigating, and one such study from Germany, and Germany has shown very good results in treating COVID patients. Their mortality was very low too. And out of the 100 patients put to the ventilator, 97% patients survived in Germany. So it's one of the best in Europe and all globally also. Now coming to our subject, a second such study was taken by all European investigators, cardiac scientists. So they did also echocardiogram, 3D Doppler, etc., and everything possible. And they found that 52% of the patient, little less than 78%, are affected by these heart ailments, and they have got mild LV systolic dysfunction, means the heart is not contracting well. So they are also developing heart failure. So these are very, very bad messages from the recent researchers, very recent researchers. This CMR study came 2 or 3 weeks back, and this was published in a peer-reviewed journal. So these are very disturbing news to us doctors and cardiologists also, that patients are being all right, and then after some time when we are going for this sophisticated test, we find the patients are not all right, they have got serious heart problem. And within a short time, they are developing some symptoms. As I mentioned, that the lung symptoms, COVID patient is okay, declared all right. After that, you see also it's happening with VVIPs. The patient is readmitted to the hospital. Means it is causing some impairment of the lung tissue. It causes fibrosis of the lung. Similarly, heart is being also affected. We know that in any viral infection, there can be myocarditis, there can be heart failure, there can be high heart rate. That's common during the disease. But after that they recover. Of course it can persist for some time, but after they recover and the heart becomes normalized in majority of the patient. But this is something abnormal about the coronavirus, because as you see the picture, the coronavirus has some spikes. Whether these spikes is causing these disturbances, we don't know. As I told, we don't know much about the disease. But it's happening. We are seeing the recent data, recent trials and recent researches in the best of countries are showing that they affect the heart in the long term, they affect the lungs in about 50 to 78% of the patient. So this is very disturbing.
So, sir, since COVID-19 affects the heart and other organs of the body so adversely, can you give an insight on how to prevent this disease?
Yeah, that's very important. You see, there is no 100% prevention for the disease. But what I mean to tell, that everything can be prevented, and especially this one also can be prevented to certain extent, but it's not 100%. First of all, that's my humble submission. We don't know how to prevent the disease completely, because I find some people, they don't go out of the house, absolutely inside the house, and have kept cylinders, oxygens, everything, and they are fully prepared to fight the disease, but they have got contracted the disease. So that is another story. But again, from day one of lockdown, I personally have been working, my colleagues have been working here. We have been going to the Cath lab, doing regular angioplasty, seeing patients in the OPD from day one in my chamber over here. But due to God's blessings or whatever you tell, we are going on. So if we try to follow some tips and tricks, I think we can largely prevent the disease. And some of the data are coming which are encouraging, like using a mask. It's an universal phenomenon. Initially, some of our friends were also telling, no, masks are not required. But now everybody is telling mask is very much required, and it prevents the disease. And secondly, today also morning, somebody was telling that it acts as it has come in the journals too, as a partial vaccination. Because if you use a surgical mask with these rings in the ear, means you fit it like this, that causes 50% of filtration. So you are getting something, you are getting some COVID. If you come across such a patient, it's always there. The situation, so many patients are having it. Some particles are, droplets and fomites are going about here and there. So 50% filtration is there. In the surgical mask, which has got ties, means you have to tie it. So that knots, that has got a 70 to 75% filtration. So they are little more better than this mask. And thirdly, the N95 mask, they are having this nomenclature because they filtrate 97 to 98% of the viruses. And we should not wear this N95 mask with valves, because then from these valves the air goes outside, and if I am a carrier, asymptomatic carrier, the viruses go out from my mask to somebody else, and he or she can be infected. So that's not fair. So we should not use mask with these valves. We should use N95 mask as such, and I would request you to put masks which have got a numbering like ISO or CN, that's the European index, etc., etc. Sometimes I won't name the companies, but these sort of things always you see, because some of the masks are not good. So these masks are a good thing, and wherever we go out, and that is number one. Number two, we should make it mandatory. We should make a distance of 6 feet, if required more, at least 6 feet, and we should always keep it. And because it's very helpful, and we should prevent small meeting or larger meetings. We are not having any meeting from our Cardiological Society of India. Every week we are having meeting. As a NIC chairman, every Saturday we are organizing meetings. But that is virtual meeting. All are virtual meetings, not meetings across the table. So that is another important message, that we should not have any gatherings till now. Therefore, the schools and colleges are not opening, because the experience in some of the countries after opening the schools were bizarre, very bad, and therefore it has not been done. Fourth thing, which is very important, washing the hands. I'll go to Cath lab now. First thing I will do after entering the lab, I will wash with soap. And not only for 20 seconds, if possible for 30 to 40 seconds. Take care of the tips of the fingers. It may seem we know everything, what's new in it, but it's not done always. We find it. So we should meticulously wash the hands with soap and water, and I think it's better than the sanitizers. Then, fifth, the sanitizers is very good. We should always use it when soap and water is not possible. Suppose in your car, after opening the door, put a little alcohol, more than 75-80%, that is mandatory. 20% alcohol won't serve the purpose. So 70 to 80% alcohol, rub well, and that causes death of the virus. These viruses are not living particles outside the body. Once they get in touch with the secretions, they are activated and they become living organisms. So that is very important to keep the distancing, social distancing. And then proper normal lifestyle measures. What are these lifestyle measures? Good eating. Take fresh fruits, vegetables, fish, nuts, almonds. They also boost our immunity, like turmeric, then sour articles like lemons, citrus fruits, oranges, etc. They're very good. Take 2-3 lemons every day. That's very, very good. That prevents the disease. I ask my patients who are heart patients to take some vitamin C tablets, 500 BD. It's not my prescription. It's a double Nobel laureate's prescription who got Nobel Prize twice. So he told one of our senior colleagues when he went to US, they were in a meeting and he was having cold and cough, and he told, okay, you please take some vitamin C tablet, you'll have a good tour of US. Because vitamin C prevents this cough and cold and viral infection also to some extent. Vitamin C is important and you can take it in a natural way if it is taken in an adequate way, say 3-4 lemons per day, or oranges, citrus fruits, mosambi, like that. And fourth important, it has been found that patients who have a low vitamin D3 concentration in COVID, as in other diseases, non-COVID diseases also, if they are affected with some serious illness, because COVID is a serious illness, the mortality and severity of the disease is much higher in cases of such patients who have this low vitamin D3 in their blood. So we should take vitamin D3 regularly, and we should check it in between so that we don't also have hypervitaminosis D, because that can cause problem with the parathyroid gland. So both ends we have to, as it's happening, everybody is taking zinc now. So we should not take zinc in a very high dose. We have zinc in our food. Okay, you take a little bit of zinc in tablets, but in between. Say zinc tablet 50 milligram once in a week or twice in a week. That's all. Otherwise, it will cause hyperzincomia. So it's not, appreciated. Like selenium, we shouldn't take all these minerals, in a very high quantity. These are not good. Iron is good for anemia. But if we took iron indiscriminately, they cause, hemosiderosis and other things, it can cause some problems. Hyper iron is not, good for the body. So we should be not taking this. Vitamin B complex we don't advocate to take. If this hasn't got much function, okay, somebody is deficient, of course she can take for small time. Most important is that we have to do regular exercise. Exercise increases, immunity. We should do asans if possible. This is very good. This is a rich science of ours with 5,000, 10,000 years of heritage. And next, we should, go for some pranayama, because if we can keep this bronchial tree and our lungs moist, then it prevents the corona infection. Because corona flourishes in dry surface. So if it is moist, the bronchial tree and the lungs, the corona cannot flourish there. So that's another way of keeping us healthy and in a proper fitting. Also, we have to keep our blood pressure at normal level, our weight at normal level. Because it has been found that who are obese, who are overweight, they do badly with this COVID-19 infection. Complications are more in overweight patients. Death rate is more in overweight patients. And they don't do well because there are several explanations why it happens in obese patients. Like in obese patient, diabetes is more common, metabolic syndrome is more common, hypertension is more common, which means high blood pressure. Cancer is more common. 13 types of cancer occurs in overweight or obese patients. So like that, COVID patients who are obese do not do well. Their fatality is high, They are severely symptomatic. They many a times need ventilation, non-invasive or invasive ventilation. So we should be very, very careful that we should have a proper weight. We should not gain weight. If we are overweight, we should try to shed our weight quickly and efficiently, not very quickly, of course. And then we should keep our blood pressure at a normal level, blood sugar at a normal level. And many patients ask us what we should do with our regular medicine. Some people take some heart drugs for the heart. We tell them, please continue with your medicine. Nothing extra is required. Little bit of vitamin C, D, just to keep the vitamin D at an upper level, upper normal level. Except for that, nothing is regular, good lifestyle method. These are not COVID specific. This we ask or we ourselves practice throughout the year. This lifestyle practices. So this is very good for the body, especially some foods like nuts, citrus, fruits, fresh vegetables, food with lot of fibers. These are very good. Egg also gives very good immunity. Those are non-veg. We can take some boiled eggs. This is very good. They increases the immunity, and they have got zinc, selenium, and many other substances. So normal food, not very costly food is required, and proper digestion, and don't be panicked about this disease. That's also very important. Many of us are absolutely panicked. We see heart attack patients, we take them on the table, sometimes immediately, sometimes little later, and then we do the angioplasty. But we should not get panicked about the disease. That's very detrimental for one's good health. So in short, these are few of the tips I should tell, and we should not go knowingly in touch with the COVID patient. We should treat them. But the transmission of the disease is by very close contact with the patient, and that too for 10 to 15 minutes. So we should try to avoid. If we have to treat, we have to go by, even we are in PPE suits. That's what we do over here in our hospital. But otherwise, we should not go in close touch, though, because everybody is not doctors, so they need not go to in close contact. And another important thing is, in the house, when there are elderly people, we should keep a distance from them. They should be in a room preferably, and they should have separate toilet and washroom, and we should not go very close to them. We should talk with them keeping a distance of 6 feet. So above the age of 60 or 65 years, one should better be in the house and in a special zone, means rooms, and even small children should not go to them. Because sometimes it is found many of us are asymptomatic carriers, because the prevalence of the disease is so high, and that we have come to know that in all the metros the prevalence of the disease is 25 to 28% by random antibody test, which is not done, of course, in a very big way in our country. The testing is not that much, and therefore we are showing that the numbers are coming down and the recovery is very high, because even 5-6 days back the numbers daily was near about 1 lakh, but now it's showing to be 75,000 or 80,000. That's because of less testing, and the RT-PCR cycle has also been reduced. So less of testing, less of diagnosis, naturally less numbers will come. But anyhow, we are having a severe affection of our society. I don't want to comment whether community spread has started, whether the second wave has started, whether we have reached the peak. These are all technical jargons. But what we are seeing, that the COVID has affected more than 52 lakhs patients in our society, and in US yesterday they touched 2 lakhs death rate, which is the highest in the world, and today it is 2,05,000. And in a country which is known to be the mecca of technical medical treatment, they have been affected. 68 lakhs people affected. They are on topping the list. But very soon we are going to overtake them by all means. So that is for sure. So anyhow, this is a new disease to us. This is a dreaded lethal viral disease with varied manifestations, which we discussed, and sometimes the manifestations are not like cough or fever only. I told about nausea, vomiting, diarrhea, loss of taste, loss of smell. So we have to diagnose the disease at its very initial phase, so that the further course we can control. It's controllable till now, There is not very good treatment for the disease as well. We don't know much about the cytokine storm. We are giving steroids, and steroids has been shown to give very good results for the disease. And also, this cytokine storm has been prevented by some anti-inflammatory molecules which are used in rheumatoid arthritis patients, like tocilizumab, which is an anti-inflammatory monoclonal antibody, and they are working well. Another therapy which has been working well, and in Russia especially, the mortality was low and the recovery rate was very high, who were admitted in the hospital because of the fact they used this plasma therapy in a big way. And the plasma were given in a very good way after proper screening and everything being done. So though the ICMR is telling that the plasma therapy is not very successful in India, I don't want to comment about it, but in some of the advanced countries, it has shown to be very, very efficacious. And so last but not the least, about the vaccine. So the vaccine story, we are seeing 130 vaccines are being manufactured. Some use mRNA technology, some use adenovirus. Like AstraZeneca, like J&J, Johnson & Johnson, they are using adenovirus. Russia has 2 varieties. Yesterday they have gone a 3rd variety after Sputnik 5, 2nd variety, and 3rd one they have given a name, vector. I have forgotten it. So first 2, the vectors are adenovirus, as in J&J and this AstraZeneca, it is adenovirus, and they are giving some spikes. So Russia has come out with the vaccine earliest first because of the fact they had the platform for the adenovirus. So they added some spikes on it, and that is the thing. And now they have come with some dead virus, and they are giving this vaccination. They are going to have a 3,000 patient phase 2 trial or 3 trial. And China has come out with an injectable vaccine and has come out with the drops, and these drops are being given in Middle East. UAE is participating, and many other countries like India is also going to be partnering with Russia, as you have found that they will be selling 10 crores of vaccine. But this is not all the story. We cannot give vaccination to all the patients, because it's not only 10 crores of vaccines. We can manufacture 10 crores vaccine, but where are 10 crore syringes? Where are 10 crore needles? At the same time, it's very difficult to get all these things. So it's not a simple problem. And this is having a severe problem on our economy. The economy is going downwards, and it's affecting all the economy. The US economy in the month of May has squeezed by 25%. So all the Chinese economy has shrunken. So all the countries have been, affected to certain extent. But anyhow, let us hope for the best, that this is becoming, vaccine is coming in the end of this year or by the early part, February, March of 2021. But as Microsoft chief Bill Gates has told, that probably COVID will go across 2022. Means another 2 years we have to wait. And after that, WHO president has told that Tedros, that will be able to finish this disease by 2022, end of 2022. So let us hope for the best, and let us hope that, and I wish you all that you all become healthy and don't be affected by disease, and don't panic. Don't panic, and we are there for your service, and we are largely a non-COVID hospitals. But okay, when heart attack patients come, we don't screen who is a COVID, who is a non-COVID patient. We go for the job, and our patients, we have got a high cure rate, and the recovery rate is going up. That's very good, and outcome of the disease, I hope, is going to be good in the near future. And I also want to tell a fact that Indians are doing little better than other countries like US. If we compare, the mortality in US is little high than India. Not to tell of Italy and France. Italy and France, the mortality was more than 10%. In Italy, it was 12% because of the fact many of the patients were octogenarians or nonagenarians. Because Italy and France is one of the countries who have got a highestly aged patients, means they have got 100 years. And again in Italy, 104 years old patient has gone home after having severe corona infection. So our mortality or fatality rate is little low, recovery rate is little more because of the fact we have gone through many infections since the childhood, and majority of our childs are being vaccinated nowadays. Like it's being told that MMR vaccine prevents this COVID-19 also. So some people out of this euphoria are taking MMR vaccine. There was such a thing about influenza vaccine, that if you have got influenza vaccine, you'll get it. One Indian physician, he's a chief of neurosurgery department, he was telling that if you take a BCG vaccination, the chances of getting the infection is very less. At that time, we Indians were having very small load of this COVID-19. But it's not true. We are having 52 lakhs people affected in our country. Of course, if you compare with our total population, 1.4 billion, the numbers are not so big. But of course, it's going to be further increasing, and that is not, of course, a good thing. And this regarding lockdown, just to update you, Israel has started lockdown for 3 weeks from 18th of September, and today is day 6 of the lockdown. And UK has been doing lockdown in several places like Manchester, Wales, and some other pockets, localized lockdowns. Many other countries are doing this. Italy has been actively considering whether they want to go for a second lockdown because the numbers are increasing. There is a second wave going on in France. The second wave has caused almost 10,000 persons per day affection. In Brazil also, they are third now. We have overtaken Brazil. So Brazilian study recent tells that persons who have dengue fever, they are immune to this COVID-19. That's like a vaccination. We don't know what is true or not. That's about a latest Brazilian study which came this morning. So these are some of the tips regarding the recent disease, but just I want to tell you in a nutshell, if we follow the simple health hygiene, then of course I am sure we'll be largely able, say more than 90%, 90%, 95% to prevent this deadly disease, COVID-19. So I think that's all about COVID-19. Have you got any more questions?
So, sir, thank you. First of all, thank you for beautifully explaining the topic. We might have some questions from our viewers.
Okay, sure. Okay, sure.
We'll just check it out. So there is a question which from our viewer, any study that how much COVID plasma is required to save the serious patients?
I think in Russia they have got the maximum experience among the European countries. Now the France and Germany are following them, and they have used a few bottles of plasma. There is no that 1 bottle, 2 bottles, but say 3, 4, 5 bottles of plasma have been used. But one thing is for sure that in Russia they have been screened very nicely. We are not getting that good result in our country because everywhere, especially apart from the metros, in the peripheries, I don't know how this blood procurement is safe, and all these factors have to be analyzed in detail because the plasma therapy has been found to be very good, and US has also started, and they had discussion with the Russian counterparts, and they have also started doing this therapy in US, in plasma therapy. So I think a few bottles are required. That is according to the severity of the disease, and 1 or 2 days it's being given along with remdesivir and steroids and sometimes tocilizumab, etc., etc.
So thank you viewers for listening to us and such wonderful comments. For any query or appointment required for Birla Heart Research Center, you can call on 033 4088 4088. Till our next live session, stay safe, stay healthy, and Shabba Khair.